Nicole, many thanks for your time this morning. I suppose we don't really understand how dire the situation is because mental health issues in general have always taken a back seat to any other ailments that a human being would have.
Absolutely. I think there's an enormous stigma around mental health issues, and it often stops people from seeking out help or understanding how they can get the support that they need, particularly during COVID, where mental health issues have been higher, the numbers are higher than we have ever seen.
Now, absolutely. So what are some of the biggest things that children are going through just based on your engagements, their anxieties, their worries, their concerns that they've experienced during this particular time?
Look, I think all children over the last 2 years have experienced enormous losses. What you were speaking to earlier, obviously the most tragic are those that have lost family members, caregivers, etc. But I think all children have experienced loss, whether it's loss of time at school, whether it's loss of their freedom, loss of normal development, and I think loss of just a kind of happy times in their childhood where they've been filled with lots of anxiety and worry and concern, and also where the adults around them have been themselves traumatized and upset and often unavailable to them. So I think it's been a really difficult time for children across the world.
No, absolutely. And how do they deal with this, Nicole? Because as we've mentioned, many of them have lost a parent, have become orphaned, and not a lot of them would have a big family unit to support them. So ultimately, they have to find coping mechanisms and ways to deal with the way that the world has changed. How would you advise that a child approach this mammoth change that all of us have been forced to go through?
Well, first, just to kind of set the scene, to explain why, in fact, it is so difficult at the moment for children who've lost parents. We know that research has shown us that any child who loses a parent is at a greater risk for their mental health. They're much greater risk for things like depression, even suicidality. But children who've lost parents during COVID have had added issues where they haven't had the normal social supports that kind of kick in when you lose a parent. Often there isn't a proper burial and all of the normal rituals that normally take place that help with the mourning and grieving process. Often children have had to grieve in isolation. They haven't had neighbors dropping by, friends to support them. And so certainly children are much, much more at risk. And also, it's not to discount that not only have they lost caregivers, but they've lost, they've lost parents who are financial breadwinners. And so the trauma doesn't just stop at the loss and the grief of losing a parent, but also the other concerns that kick in around, is there going to be money to pay for things? Who's going to take care of us? And so, in fact, I think it's incredibly difficult for children to be facing this on their own. And that is why it cannot just be the burden of children to now try and cope with all of that trauma, all of that grief. I think that on a societal and a communal level, things have to be put in place that kick in to say, hang on, how do we not only support these children, but the families and the infrastructures that are now taking over that burden so that these children have some ability to get through, to mourn and grieve and kind of continue without the kind of unresolved grief and burden of trauma that may stay with them for the rest of their lives.
So then talk us through some of those resources that would exist for children to get that kind of support, should it not be within a family unit scenario. I know there are a lot of resources for adults who have going through different traumas, but is there enough for children who need that kind of support?
I would say there really isn't enough. And that's part of some of the thinking that has to happen at kind of government level. COVID-19 cannot just be about prevention, although we know vaccination is so important. It cannot just be about treatment. We have to be putting children at the forefront of our thinking, whether that's making funds available, whether that's making, putting policies in place. But I also think even at communal level, churches, schools, NGOs all have to be thinking around how do we put supports in place? And, it's interesting that we've learned a lot since the AIDS pandemic, the orphans that were kind of created through that tragedy. And we know that that in fact children can be helped where there is rapid access to funding and where there is rapid access to support of those infrastructures that are taking care of them. It makes an enormous difference to their mental health and to their ability to be resilient and to move forward. Where that isn't in place, those children are much, much more at risk, both in the short term and in the long term.
And it's very important, as you say, that communities get involved, churches and other surrounding infrastructure for those who might not have the privilege of having an access to a phone or an iPad where they could just call a toll-free number to speak to someone or a family member that may not be nearby.
Absolutely. In some ways, in the same way as COVID really was something that affected all of us, this too is a problem that we all have to take seriously, and that kind of society at large and various communities, who's ever in your community, has to be partially responsible for taking care of these children and making sure that the infrastructures are in place. Absolutely.
Absolutely. So before we spoke about community involvement, you mentioned that if a child does not get the support that they need, they could be exposed to various risks. What are some of those risks?
Well, we know that children who are grieving need adults to be talking to them about death in ways that they can understand, and they need to be helped with the feelings that come up as a result of loss, grief. And I think that without those kinds of processes and without adults that are helping children, children are much more at risk for depression, for anxiety, and even in kind of much more serious cases for suicidality. Those kinds of mental health risks are very, very much at the forefront. But we know that where children can be helped to talk about what they're experiencing, to talk about the loss, to talk about their fears even, it can play a huge ameliorating role and protect their mental health. We know that toxic levels of stress, toxic levels of trauma are very, very damaging, and that's what we're needing to prevent.
Yeah, we've spoken about some important components here in terms of getting a child the support that they would need, in terms of engaging them and making them understand what the trauma they're going through is. And sometimes they are given medication. But Nicole, I just want you to stress how important it is for a child to actually be active and to get a chance to play and to release whatever negative energy that they're experiencing, especially now. How do we do that now in the time of COVID when there are a lot of restrictions in place?
Look, it's very, very challenging. I mean, you've spoken about a number of different factors. So obviously emotional support is one of them. You've brought up medication. You've brought up being active and exercise. And we know that these are all absolutely fundamental parts of creating mental health structures. And look, I think it's going to take some creativity. The hope, I guess, is that as we move, hopefully, a lot of the evidence is showing that we're moving from a virus that was absolutely deadly, and we're hoping that it's becoming less so. And I guess what I'm hoping is that over time, that those kinds of severe lockdowns won't be happening to the same extent. And then I think the challenge for society is, how do we mourn, how do we process, how do we make sense of everything we've experienced over the last 2 years that has been so traumatizing. But I think we're going to have to be quite deliberate and thoughtful about what we put in place now.
No, absolutely deliberate and thoughtful indeed. That's child psychologist Nicole Canin joining us to speak about how children deal with death within their family. Some of them remain with just one parent, and many of them, unfortunately, then remain orphaned.